Sarah and Mike both had a sibling who died of cystic fibrosis, Matthew and Claire. According to the test results, Mike was a carrier for the most common disease allele, delta F508, that causes cystic fibrosis, and Sarah tested negative for cystic fibrosis mutations. Mike's parents nor did Sarah's parents display any symptoms of cystic fibrosis, meaning they either have no allele for delta F508 or they are carriers. Since Sarah's sister Claire had cystic fibrosis and Sarah doesn't have the allele delta F508, Sarah's parents both need to be heterozygous. In Mike's family, Matthew had cystic fibrosis and Mike has an allele for delta F508. Mike's parents can either be heterozygous and homozygous for delta F508 allele, or both of them can be heterozygous. Cystic fibrosis is inherited in an autosomal recessive pattern, so in order to have this disorder, both copies of the gene are needed. The gene responsible for cystic fibrosis is called cystic fibrosis transmembrane conductance regulator gene. It's located in chromosome 7 and it's responsible for coding the protein cystic fibrosis transmembrane conductance regulator. The mutation in the CFTR gene changes single protein building blocks or deletes a part of DNA from the gene. Delta F508, which is the mutation Mike carries, is very common and it alters an amino acid at position 508 in the CFTR protein. It results in a breakdown of the channel and prevents it from reaching the cell membrane, making it unable to transport chloride ions. What happens is that because the flow of chloride ions control the movement of water in one's body, it can't finish the job it's supposed to do, such as producing thin mucus. Because this mutation stops the channel from functioning properly, it can't control the transport of chloride ions and the water that goes in and out of cells. It leads to the production of thick and sticky mucus in the lungs, pancreas, and other organs. This mucus mutation clogs the airways and glands, resulting in coughing of thick mucus, constipation, and clubbing. The chance of Mike and Sarah's baby getting cystic fibrosis is 0. Since the gene for delta F508 is recessive, using Mike and Sarah's genotypes to draw a Punnett square, there's a 50% chance Sarah and Mike's baby won't get delta F508 allele, and 50% chance the baby will be a carrier. Prenatal diagnosis for cystic fibrosis is usually for pregnancies in which antenatal ultrasound imaging shows particularly light spots or when the baby is at an increased risk of cystic fibrosis. One of the options is molecular genetic testing. Molecular genetic tests include genotyping to detect specific pathogenic variants, exome, and genome sequencing. Treatment for lung problems are antibiotics, inhaled medicines, vaccine, pancreatic enzymes, lung transplant, and oxygen therapy. While some medicines, vaccine, and therapy don't have much risks, there are a few that could have side effects. Antibiotics prevent and treat lung and sinus infections, but it has drawbacks such as development of antibiotic resistance, tinnitus, hearing loss, renal failure with long-term use, and changes in the voice. Lung transplantation is considered when the patient's survival is at risk, but it can cause liver disease or diabetes. Therefore, a pancreatic or liver transplant might be performed at the same time. Some of the best course of treatment for cystic fibrosis are regular medical care and home treatment, such as postural drainage. Taking medicines can also help one to live a relatively normal life, as long as the condition is minor. If the condition is too serious to be treated at home, seeing the doctor and discussing options such as therapy and transplantation is recommended.